other question we can answer here.
If a patient refuses to chew or taste supplements you recommend, do you increase the dose?
Actually, the dose remains the same. Explain to the patient the supplement is really a food in a pill form and it should be chewed. You know, a lot of patients don't like to taste them. I can understand it. If some patients have really sensitive digestive systems and starting in the mouth, if they're going to chew it and they're going to regurgitate or have a real hard time with it, then I think you can have them swallow it, but at least have them try to taste it first. But if you demonstrate that changes in the indicator when tasting the supplement are present, then that often helps the patient. It's a helpful persuasion, as we say. If you see the patient saying you can take this and swallow it, it won't necessarily change anything. But if you do taste it, this is the response. It's almost like getting a free treatment by changing the range of motion, which doesn't happen except very, very slowly over a long period of time as you swallow it.
Often, Wally, when I'm seeing a patient with a difficult problem, I always, in tasting or taking their supplements, even after they've seen the dramatic changes in an indicator, I say, well, they ask me, well, can I just swallow it? And I'll say, if you taste it, you stimulate the neurologic response. It's like seeing the doctor, seeing me 3 times a day when you're taking these supplements, because you're stimulating those pathways. I said, if you can't chew them up, then taste them for as long as you think you can and then swallow them. At least you'll stimulate those pathways a little bit. If you can't do that, then go ahead and swallow them. It'll just take longer for those neurologic consequences that we would otherwise have by visiting your doctor on a daily basis, by chewing your supplements or tasting your supplements would have. And it'll take longer, possibly take longer to get the lasting result, but you'll still achieve that over time. So these are kinds of questions or kinds of discussions that you can have with your patients. And after they hear that, some of them who are not as sensitive and don't regurgitate every time that they taste the substance may choose to stimulate their neurology when you give them the notion that this is like getting treatment when you're away from me.
I say to the patients something you have all heard me say many times. This is why our mouth is up here close to our brain instead of down here close to our stomach for that neurological response. I tell patients that and they kind of laugh, but then they get a little bit more of the idea.